Any comfortable pose, cross your leg. Keep your back straight and put your both wrists on your knee. You can make a chin mudra here. Just relax your shoulder. Keep smiling face and keep your eyes closed. Inhale and exhale. Relax your shoulder and relax your face muscles. Relax your mind and relax your whole body. Only relax. Concentrate on your breathing. Inhale and exhale. Inhale, exhale. Om chanting. Inhale. Just make the vibration. Again, inhale. One more time, inhale. Now both palm together. Rub your palm, make a heel. Now place your both palm on your eyes. Relax mind and relax your eyes. Very gently open your eyes and look up at your palm. Hands down. Inhale and exhale. Both hands up. Make finger lock and stretch your both hands. Lift your shoulder up and look up. 5, 4, 3, 2 and 1. Come back, inhale, exhale. Now open hand to the side, inhale and exhale. You can straight your hand. If you can drop your elbow down also. 5, 4, 3, 2 and 1. Come back. Inhale. Exhale now on to the left side. Right hand up. 6, 5, 4, 3, 2 and 1. Come back. Inhale. Exhale. Hands to the knee. Slowly rotate your neck. Opposite side, opposite rotation. Now relax your neck, open hand to the side and rotate your hand also. Just try to keep your back straight. and rotate your hand and shoulder. Very nice. So the opposite side, opposite rotation. Now put your hands behind, inhale, exhale, look up. Shoulder down, 5, hold it. 4, 3, 2 and 1. Come back. Inhale and exhale. Put your hands front and keep your back straight. Go down. Slowly, slowly. 6, 5, 4, 3, 2 and 1. Come back. Take inhale and exhale. Now open your legs front. Just relax ankle and relax your knee. Yes. Okay, everyone. So here you can sit again. You just take your notebook with you together. Take a pen with you together. So everyone, you can write. So today our topic is about the Shat Karma cleansing techniques. Shat. Okay. So here, first of all, we should know the meaning of the Shat Karma. So for that, in Hatha Yoga described, we should know the meaning of Shat Karma. For that, in Hatha Yoga, described Shat means 6. SHOT. Shat means 6. And karma means action. Shat karma. There are two words, Shat plus karma. So Shat means 6 and karma means action. So the Shat karma consists of 6 groups of sanskarma. Shat karma consists of 6 group of purification practice. And after that you can write the aim of Hatha Yoga. The aim of Hatha Yoga and therefore of the Shat karma and therefore of the Shat karma is to create harmony. Create harmony between the two pranic flow. Harmony between the two major pranic flow. The pranic flow Ida and Pingla. Pranic flow Ida and Pingla. The Shatkarma also used to balance the three dosha. Balance three dosha. Number one is cough. Cough, it's called mucus. The Shatkarma are also used to balance three dosha. It's coming to the Ayurveda dosha, and these are kapha. Kapha means mucus. Second is pitta. I can write here. Number one is cough. Cough means mucus. Second is pitta. It's called bile, and the third one is vata. Sorry, last one is vata, not pata. This one. So here you can write according to the both Ayurveda and Hatha Yoga. According to the both Ayurveda and Hatha Yoga, an imbalance of dosha. If you have imbalance in the dosha, it will result illness. It will result illness. Because of this, if it's not balanced, so a person can be ill easily. So these practice are also used before pranayama. These practice are also used before pranayama and other yoga practice. And other yoga practice in order to purify the body of toxins. Purify the body of toxins and normally this type of techniques we should not read from the books and should do the practice. So whenever you are doing for the first time, you also need to do under someone guidance who's already done before. So like that. So normally there are 6 cleansing techniques. Number 1 is neti. In neti you can say like a process of cleansing and purifying the nasal passages. A process of cleansing and purifying the nasal passages. And what's come in this? In neti, jala neti and sutra neti. Jala neti. Jal means water. Jal neti and sutra neti. Second is dhoti. About the explanation we will do after. First you write the name. In the neti, two types, jala neti and sutra neti. Second, dhoti. I can write here a little bit. So here, Jalneti and Sutraneti. Second one is Dhoti. Second one is Dhoti. So in Dhoti, a series of cleansing technique, a series of cleansing techniques which are divided into three group. Number one, in the three group, number one, Antar Dhoti. Antar Dhoti means internal cleansing. Antar Dhoti. Second is Sirsa Dhoti. Sirs Dhoti, it's mean head cleansing. Sirsa, S-I-R-S-A, Sirsasana, same. Sirsa Dhoti, head cleansing. And normally in the traditional world, we say to this is Danta Dhoti also. Danta Dhoti. Yes. Next one is next one is Harit Dhoti, or we can call it throkic cleansing also. Throkic cleansing. So here you can write the internal techniques. The internal techniques clean the entire alimentary canal from mouth to anus. From mouth to anus. So for that, they are divided into four practice. They are divided into four practice. So what is the practice? Number one, you can write A, it's Shank Parshalan. Shank Parishalan. So in the Shank Parshalan, we called it so here is cleansing of intestine. Cleansing of intestine. So Shank Parshalan also two types. Dirgh Shank Parshalan and Laghu Shank Parshalan. Dirgh, it means big. Laghu, it means small. Dirgha and Laghu. Second B is about spelling. The first one is like the Shank Parshalan. I write here. Shank. You know Shank, S-A-N-K-H. Shankh Prakshalan, yes. So it's called Shankh Prakshalan. Shankh Prakshalan, the word it's take from the, Shankh. We use, yes, SHANKHAPRAKSHALANA, like this. Shankh Prakshalan. Okay. So after that, second is Agnishar Kirya. Agnisar. AGNI. Agni. SAR. Agnisar Kriya. So we do this Kriya for activating the digestive fire. Activating the digestive fire. And the next one is Kunjal Kriya. We called it Vaman Dhoti also. Kunjal Kriya. KUNJAL. Kunjal Kriya. We called it Vaman Dhoti. Vaman Dhoti. So we do this for cleansing the stomach. Cleansing the stomach with water. Cleansing the stomach with water. And the last one is Vastra Dhoti. Vastra Dhoti. VASTRA. Vastra Dhoti. So in the Vastra Dhoti also for cleansing the intestine. Cleansing the intestine. There. Okay. About more we will talk in the detail. So first you write the name. So first one is the neti, jala neti and the sutra neti. Second one is the dhoti. You write about the 4 things about dhoti also. And the third one is Neoli. NAULI. Neoli. NAULI. So in Noli, normally you just write a method of massaging, a method of massaging and strengthening, massaging and strengthening the abdominal organs. Abdominal organs. And the next one is Basti. 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 So in Basti, it's also a technique for washing. Technique for washing and toning the large intestine. Washing and toning. Toning the large intestine. And the next is Kapalbhati. KAPAL. Kapal. BHATI. Bhati. Kapalbhati. A breathing technique for purifying the frontal region of the brain. Frontal region of the brain. Head cleansing. And the last it's come Tratka. TRATAKA. Tratka. Gazeless gazing. Blinkless gazing. Blinkless gazing. It's also come into the blinkless gazing like a meditation. So the practice of intense gazing, at one point or object or object which develops the power of concentration, which develops the power of concentration. Okay, so now here we just know about the six cleansing techniques. Six cleansing techniques. It's increase the power of concentration. Last one, Kratka. Okay. So the first we will talk one by one. The first one is the jala neti, nasal cleansing with water. Nasal cleansing with water. Nasal cleansing with water. So in the short way, I'm telling you. After that, you can write about the how to do and what we do. Everything you can write in detail also. For the first, normally we should know like when we do the jalaneti. In jalaneti, like we have one pot. We put the water, salty water, little warm water, and we put it in our nostril, and then the water come into the one nostril and come out from the another side. Okay. So we have to do with the both nostril, right and the left side. So this normally is called jalaneti. So you can write the preparation first. Preparation. Preparation. So here a special neti pot. We called it neti pot. A special neti pot should be used for this. A special neti pot should be used for this. So we have to put the we have to put the top what we say. We have to put the I forget the word. The nozzle on the end. You can write the nozzle on the end of the spout. The nozzle on the end of the spout should fit comfortably. Should should fit comfortably into the nostril. Into the nostril, so that water not leak. We have to put the top of the neti pot in the nostril, so the water not leak out. The body the water should be at body temperature. The body temperature mixed with salt mixed with salt 1 teaspoon per half liter of water. 1 teaspoon per half liter of water. So here you can check the water also. So the water taste should be the same taste of the tears. The salt we should not add too much salt, and we should not less salt also, because if you not have salt, so that time you cannot perform the jalaneti. So we have to add the salt also, the white salt. Normally we use in the house. You can use that one. And when you do this thing, when you do this neti, so if you feel sometime, if you feel like paining or if you feel some burning sensation, so it's mean you don't have enough salt. We have added salt. So okay, you can write here the addition of The addition of salt ensures the addition of salt ensure the osmotic pressure of the water is equal to that of the body fluids. And if you will add too much salt, so you will feel like the burning sensation. If you will add too much salt, you will feel burning sensation, and you can feel it will be painful. So the water should be the salt should be no more. Should be the taste of tears. So for that, the procedure, you can say procedure how to do. For the first, fill the neti pot with full of water. Fill the neti pot with prepared salt water, you can say, with prepared salt water. You can do it into the standing position also, you can do it into the sitting position also. If you are doing into the standing position, you can open your legs. If you are sitting in the position, also you can sit in this position, just normal position, just sit down. You can put your one hand here, just take the neti pot and put into the nostril like this, only here, this one. Just little bit and to the side. You don't need to straight and put or something vary or something, just no more here. Okay. So first close the eyes for a minute. First close the eyes for a minute and relax the whole body. And relax the whole body. And then tilt the head into the one side. Tilt the head into the one side, slightly back. And whenever you are doing, you have to breathe from the mouth, not from the nose. You have to breathe through the mouth. During this process, you have to breathe from the mouth. And after that, gently insert the nasal. You have to put the pot into the nostril. Yes. So when you put the top of the pot into the nostril, then wait, open your mouth. You have to breathe normally, inhale and exhale. And then what will happen? After 5 seconds, 10 seconds, the water will come out from the another side. And when half the water has passed away from the nostril, when the half of the water passed away from the nostril, remove the nozzle from the nostril, center the head. After remove it, center your head, and then the remaining water, let it come out from the nose. Center the head and let the water run out of the nose. And if you have any mucus, just remove it. While doing this one, you should have one towel also. If you have any mucus, just remove it from the nose. You can use towel for clean the nostril. And after that, tilt the head into the another direction, opposite side. Before you do right side, so after that next you do the left side, the opposite side, and repeat the whole process. And after completing the process with the both nostril, after completing, you can do it like the two times also. One side, right side also you can do 2 times, 3 times. Both side, each side. It's not like one time you do left, one time you do right and finish. It's not like that. You can do like 2, 3 times also. And after completing this process, the nostril must be dried. The nostril must be dried. So how to drying the nostril? How to make dry to the nostril? So first, stand erect. Stand erect and close the right nostril with the right thumb. Close the right nostril with the right thumb and breathe in and out through the left nostril. You can do it 5 to 10 times until the water comes out. Like the same you have to do with the Kapalbhati. So you can do just close your one nostril and this one. So all the water come out, remaining water. And after that you can do with the opposite side. Repeat through the right nostril. Same. And one more thing, this is like only with the one side, and you can do like the with the both nostril also, right and left side, like this. Okay, right and left side. You have to breathe out like the same like the Kapalbhati. Just stand in the standing position. You can put your hands onto the knee and then you can perform. Okay, put your head down and you have to do like the Kapalbhati. Breath out with the both of nostril also. You can do it together. Because sometime after do this process, water remains in the nose, so it can create little bit problem like the headache, and it's not good for the ear and something if water is inside. So take care, make it dry, and all the water should be come out from the nostril. See, about the water, you can prepare like near about 1 liter about water, and it's good like if you have 4 or 5 neti pot. Okay, and you can do it like the 2 or 3 times with one side. Full pot you can do. So about the duration. So this process, this practice should be take around 5 to 10 minutes. This practice, it's take 5 to 10 minutes. And neti we should do neti may be practiced once daily in a week. Once daily in a week. And if someone have like more problem about some blockages and that, so they can perform like 3 times also, like one time one day do. So yeah, wait for that. So you can perform it 3 times a week also. You no need to do every day. You can give one day rest also. Okay, one day rest, one day you can do. Otherwise, normally if you are doing, so you can do 1 week, one time also. Okay, and sometime if you have any blockage or something, that time also, mucus blockage, so also you can do it. Okay. Yes. Yes, it can be damaged if you do every day. So that's why I'm saying normally you should do once a week. So awareness. How about the awareness? You can write the physical awareness on relaxing and positioning the body. Relaxing and positioning the body. Making sure that no water leak out from the nozzle of the pot. That no water leak out from the nozzle of the pot. And relaxed breathing through the mouth. Relaxed breathing through the mouth. So this is the physical awareness. Like we should remember when we are doing the neti pot, we should remember that the water not comes out. So it will be our physical awareness. And about the breath also, we have to aware, like we have to breathe from the nose, like little bit open your mouth, open your lips and inhale, exhale slowly. No need to something like this, just little inhale and exhale. Only not inhale and exhale from the nose. Okay. And the spiritual awareness will come on to the Ajna chakra. AJNA, Ajna Chakra. And sequence, when we should do about Jalneti is sequence. Jalneti is ideally practice in the morning before asana and pranayama. Before asana and pranayama, we should do Jalneti. And about the precaution, the water should only pass through the nose. We should take care that the water should be passed through the nose. And if any water enter the throat or mouth, it is the indication that the position of the head needs to be adjusted. So if the water enter into the throat or mouth, it is indication that the position of the head need to be adjusted. Make sure that the nose is properly dried. Second, make sure that the nose is properly dried after the practice. Otherwise, the nasal passages may become irritated. irritated, and manifest the symptoms of a cold. And manifest the symptoms of a cold. And don't blow the nose too hard. Do not blow the nose too hard, as the remaining water can come into the ears. And after, you can write the contraindication. Contraindication: those person who is suffer from chronic bleeding in the nose. Some persons, they are suffer with the chronic disease like chronic bleeding in the nose, should not do jalaneti. And some of those who feel difficulty in passing the water in the nostril, they also need to be take care, because some persons, they have like the more blockages and their structural blockage. Some person, they have like the long bone also inside. So some person, if they cannot do, so they also need the guidance of the expert. About the benefit, jalneti remove remove mucus and pollution, from the nasal passages. Jalneti removes mucus and pollution from the nasal passages and sinuses. And sinus, allowing air to flow without obstruction. It helps to relieve allergies. Some person, they have allergy also. It helps to relieve cold cold and sinus. And more, you can write jalneti, it removes tension. Jalneti, it's relieve muscular tension. Jalneti relieves muscular tension of the face. And it has a cooling and soothing influence on the brain. and it's beneficial in the treatment of migraine also. Treatment of migraine. And more, it alleviates anxiety, anger, depression, and dark circle. And it's also increase the eyesight and the hearing problem. Eyesight and hearing problem. You know. Okay, so this is about the jala neti. So maybe the next time we'll do the practical. So after that you will know more clear about the how to do the jala neti and which the things we need to take care during the jala neti. Okay. So maybe the next time we'll do the practical. For now only the theoretical. So second you can after this you can write about the sutra neti. Sutra neti. Nasal cleansing with thread. Nasal cleansing with thread. So here you can write about the preparation. 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 So this practice involves 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 passing a length of cotton thread yes cotton thread or rubber catheter rubber catheter through the nose. See, normally it's the difference like about the sutra neti and the rubber neti. In the sutra neti, we use the cotton thread. We use the cotton thread, and into the rubber neti, we use the rubber one. It's made with the rubber, like something like right now I don't have something like this. Okay, it's made by the rubber. So for the beginner, they can do with the rubber. That one is more easily because thread it's more little bit more difficult. Okay. So you have to practice with the rubber one. So the width was near about 4 mm and the length is 36 to 45 centimeter. And the length is 36 to 45 centimeter. And it is lubricated with butter, oil, ghee, with ghee, so that slightly so that it slides, it can go easily through the nasal passages. So you can put it into the oil, you can put it into the ghee, you can put it into the butter also, so it can go easily. And during this practice also, you can before one day you can put the drops in the, you can put the oil into the nose also, into the nostril also. some good oil. So for the Sutra Neti, we have one like the techniques. You can write technique how to do. So first, take any comfortable position. Take any comfortable position, standing or sitting. You can do in both, standing or sitting. And first, relax the whole body. First, relax the whole body. So the first, tilt the head little bit back. Tilt the head slightly back. So which nostril is like more like flowing, easy, open. So for in that you can put the top of the your neti, sutra neti. You can start. Okay. So what you have to do for that, you just hold the top of the nose. This one, just hold it and slightly here, just hold it and put it into the nose. So always keep the tip pointing downwards towards the floor of the nose. Not push like upside. Try to push it little bit downside, not upside. Don't push, never push it straight up. And so in the beginning, maybe you feel some sensation of itching, some sensation of like the like maybe you can feel little bit vomiting, you can feel sneezing, okay? Maybe the tears can come out. So don't worry for that thing. It happens because you are doing for the first time. And when the thread reach in the back of the throat, when the thread reach into the back of the throat, then insert the index finger and thumb. The index finger and thumb, or middle finger and the index finger. Okay. So here is a technique how to do. So here you have to hold the catheter and you have to put it out. So you don't feel like vomit or something. You just go open your mouth, hold it. You can hold it with this, you can hold it with this. So how you can take it out. So what will happen when you will hold that one? So one portion is come from the mouth and another portion is in the nostril outside. Okay, both things. One is in the nose and one is mouth, and after you have to do here. So all the blockage passages can be open. Okay. So well, we will do the practice, the practical. That time you can understand more easily. And after finish, you can take it out from the mouth. Okay. So after that, you can write about the breathing. So breath should be come from the mouth. Breathe. It should be come from the mouth. And duration, it can be near about. This practice is take, if you know how to do, so this practice take less than 5 minutes. You can write less than 5 minutes. So you can do practice only for the 5 minutes if you are expert in this. But in the beginning, maybe it can take 1 day also, 2 days also. Because in first time you can jal neti you can do in first time, but the sutra neti you need to be little bit habitual and you need to give more time. Maybe 1 day practice, maybe 2 day practice, maybe 3 day practice in the sutra neti. But jal neti you can do in within a day. First day also you can perform the jal neti. Okay. And you can write about the awareness, the physical awareness on relaxing the body, the physical awareness on relaxing the body and moving the sutra neti catheter or thread. So you should be while performing this, your awareness should be like your breath through the mouth, and the awareness should be in this like in this sensation, like where it's going, how you feel, and how the sutra neti it will go inside sutra neti or rubber neti. Okay, and the spiritual awareness will go on to the agna chakra. Spiritual awareness will be on to the ajna chakra. And about the sequence, you can write sutra neti. You can sutra neti should be performed. Sutra neti should be performed before jala neti. Before jala neti. And precautions, do not use force under any circumstance. Don't force. Because the interior of the nose is delicate, and any undue force, it can be damage. So you have to do it. You should not do it forcefully. Don't force. So normally, like if you are trying for the first time, 1 time, 2 time, and it's not going, so after that you can clean it and you can do it again. You can clean it and you can do again. And it is best that not to try sutra neti until we do the jala neti. So first you can perform if you are beginner. So when your jala neti is perfect, when you perfect in jala neti, after that you can practice for the sutra neti. So first you practice for the jala neti first. And here you can write the contraindication. Contraindication. So the person who is suffering from the chronic bleeding in the nose, they should not do the sutra neti. Chronic disease and the blood comes into the nose, so they should not do the sutra neti. And anyone who is suffering with nasal ulcer, anyone who is suffering with nasal ulcer, polyp, nasal ulcer, polyps, so they also should take advice first. So normally the benefit is the same like the jala neti. Normally the benefit is the same like the jala neti. And more it helps to maintain the nasal hygiene by removing the dirt and bacteria trapped along with the mucus in the nostril. And some more problems like the sinus problem, migraine problem, and the headache, it also can be reduced with the sutra neti. Okay, so this is about the jal neti and the sutra neti. Okay. So today we'll do only about the jal neti and the sutra neti, because now if we'll talk about the more Shankar. Okay, so do you have any question regarding this? Do you have any question regarding this jal neti and the sutra neti?
Sir, should we do it in empty stomach only, or can we do it?
See, normally it's not effect, but normally it's good. Like if we do in the early morning, it's good if we do in the early morning, because these things only comes into the nostril, not come into the stomach. So you can perform, but try to perform in the early morning, empty stomach.
Sir, how many times we can perform it in a week?
You can perform it in a week 1 or 2 times. Normally, if you are normal, if your health is normal.
Is this rubber neti is good? I am perform it for so long. This rubber neti. See this?
Yeah, it's rubber neti is good. Rubber neti is good. And if you want try, you can try with the sutra neti also. But this one is a little bit more difficult, little bit. Okay.
And sutra neti we have to boil first, or then oiling it.
Yeah, you can boil the both,
Okay.
the sutra and the rubber neti, whenever you are doing, whenever you want to use. So first you put into the hot water, or maybe you
Okay.
can put little bit ghee on that also, and after that you can perform.
Okay. Okay, sir.
Sir, can we do Jalneti and Sutraneti when we have cold and nose block?
When you have cold,
Yeah,
yes,
cold
you
and
can.
nose block.
Yes, if you have a cold and if you have some blockages, also you can do
It doesn't
the
increase the
jal
cold.
neti, jal neti.
Does it increase the cold if we do it?
No, it will clean the mucus. Jal neti, it will clean the mucus and the blockages.
Okay.
Sir, pregnant ladies can do that?
Pregnant lady, yes, because it's not affect something, in the belly or something.
Okay.
So it's only for the cleansing the passages into the nostril.
Okay.
The pregnant ladies can do Kapalbhati, Shwasan Mark Suddha and all.
No, that one cannot do.
Because then, after Jalneti, we do that Shwasan Mark Suddhi and this one, no?
See,
Kapalbhati.
that one is not very like we have to do the pure like the Kapal Bhati. It's not like something very important notes that they cannot do. They can do also, but when you're removing the water, we no need to do Kapal Bhati very heavily. Just focus onto the breath only outside. The breath will become out forcefully from the nostril only. We no need to focus on this like this thing. Okay, in the Kapalbhati we
Okay.
focus more onto the abdomen also, but here you have to focus only the nostril breath out. Do you understand?
Okay. Okay.
Yeah.
Okay. Thank you, sir.
See, it's depend like which what time, like if they feeling something not comfortable so they can avoid. Normally I'm saying it's not compulsory for them, but if they want they can do. Because it's only for the cleansing the nostril from upper part only, not related to something about abdomen and something different. But the other something Shankarshalan, about the Kunjan, about Kapal Bhati, Bastrika, so this type of thing they cannot do. Some another things.
Sir, for Sutra Neti, we can use this cotton for all the time, or how we have to clean? If you can use again and again, so how we have to correct clean them for not
See
keeping bacteria?
for the cleansing you can do two things. Whenever you are finished, so you can boil it, and whenever you are using, also you can boil it in the water, normal water.
So we can use so many times this for Sutra Neti cotton.
Yes, you can.
Okay, thank you.
It's not like each time you have to buy new or something. You can use again also.
Yeah,
Keep it
if
keep it clean and at safe place. And every time, each time, just boil it first. Boil. It's important to boil. Boil it, and after you can use it again.
okay, thank you, sir.
Yes.
So the rubber will not melt? The
No, no,
this
no,
one?
no, no. It's not melt. It's not melt in the water. You can put it. You can take the water in the glass, hot water, and you also can put the rubber neti in that on that. And after just take it from the water and you can use directly.
And we have to do it alternative days or once in a week.
See, normally, if you do once a week also enough, but I know you will not do. You will not do alternate also, so once a week also it's good if you are
Sir,
doing.
I do rubber neti alternative days. Rubber
Good,
neti and gel neti.
good. So it's good like if you are doing into the alternative days, and if you are something very busy schedule or something, so also you can perform in once a week also. One
Okay.
week, 2 week, you can perform when you need. You can perform.
Okay. Okay, sir.
What is about spiritual awareness?
What is the
Spiritual awareness chakra, which chakra you are saying?
Ajna Chakra. About the chakra also, we will read it later, so you can understand all the chakra. It's more easily. Okay. So we'll have proper topic on the chakra.
Can you show the pot so that we
Show
can
the-
buy it? Show the Jalneti pot so that we can buy it before the practical session.
Yeah, you have to buy it. I will send you a message also what you need. So you can buy it maybe online, and maybe you can buy it at the shop of medical shop also. They keep some of medical shop, so maybe you can buy from there also. Or you can buy online Amazon or something also. You can buy. It's very cheap. It's not expensive. It's cheap one.
What is better, cotton sutraneti or pot sutran or another? For sutraneti, they have like I don't know, like a plastic or like cotton.
Which
What
one?
is better?
For sutra neti or for jal neti?
Yes, for sutraneti.
Sutra neti, yeah. Sutra neti you can take like the rubber one.
Rubber better is cotton.
See, better, if you talk about better, so of course cotton is more better. In the traditional, they always use cotton, but normally, like for you, for the beginner, you can do with the rubber neti. It's more easy
Oh, okay.
because sutra neti it's maybe little bit more big, but the rubber neti it comes into the small size, like the not very wide like this. It comes in the small size like this. Yes, like
Yeah.
this one also it can be,
Uh-huh.
like inside. Yes.
Thank you, sir.
So don't worry, when we will practice for the practical, then you can understand more easily about the Jal Neti and the Sutra Neti. So next week, let's see, we'll do a little bit, maybe both theoretical and the practical, so we can know more about the Shat Karma. So Shat Karma is very important to clean all the internal organs and to make your body more strong, power, make your immune system more stronger. So it's very good for cleansing. Okay, so yes.
We will do the practicals for Shank Prakshalan and all also.
Yeah, all. We'll practice about the Jal Neti. We'll practice about the Sutra Neti. We'll practice about the Kunjal. We practice about the Shank Prakshalan also. We practice about the Agni Sara also. Okay. So and Neoli also we will learn, but Neoli little bit advanced techniques. So it can take 1, 2, 3 months also for learning. It's not very easy for the Neoli.
तो सर हमें नेक्स्ट टाइम के लिए क्या प्रिपरेशंस करनी है हमें वाटर हॉट वाटर या ये वो
Yeah, that will whenever we need something, water or something, I will send you message before, and I will inform you about that. That tomorrow we will do this thing and this kriya. So you have to prepare water, or you need to prepare this thing or that thing. Only that.
Okay.
So for now, you can buy the Jalneti pot. If you want, I can send you picture also into the group. Jalneti pot, Sutra Neti. You have
Yes, sir. Please send the picture, sir, because I don't have that.
Everybody will not have.
Yeah.
So I will send you the picture, and maybe you can buy. You can search it onto the internet. Maybe Amazon or something. You can buy it from there. You can go into the medical shop also. You can buy. So Jal Neti and the Sutra Neti.
Okay.
And more things. More things. Maybe we need in the asana classes, like something like the state asana class.
We need the pot in which material? It should be copper or plastic or steel. Anything specific?
Which one? Jal Neti?
Yeah.
It can be into the metal also. It can be into the plastic also. It depends. Because sometimes we have tambe ki hoti hai na, copper ki uski. So that one also we can use.
Okay.
Make with metal also you can use.
This is also perfect, sir.
Yes.
Is it ceramic also can use, yeah?
Who can use?
Ceramic.
Ceramic?
Yes, ceramic like glasses, you know, because I
I,
see,
Material,
I
ceramic material, she
yeah,
said.
materials for jalanetti.
steel.
The,
You are
the pot,
talking about
yeah,
steel.
the
Steel.
not steel, ceramic like a glasses.
Like a glass. I don't know about that. Like glass. I never use glass.
Because I see in no, because I see in for sale online. It's like Chinese style.
So we Chinese style. No, I think no
Yeah.
need to use Chinese style. Use the traditional Indian style. Okay.
Yeah, because I see for the this plastic which one girls now show. Now she's show. This I think is most comfortable.
So no problem. What you find easily, you can use that one. So what you find, you can use it. Normally, I will send you picture and I will send you the detail what you need. So do one thing now. Just take rest little bit, and after we will see into the next advanced asana practice at 8:15 after 20 minutes. Okay. So
Okay.
take
Thank
care.
you.
Namaste. See you again.
Thank you, sir.
Yes. Yes. See you.